Hello and welcome to this presentation on staff health during an emergency. I'm your instructor, Sean McKay. So, working in healthcare can be stressful, especially if you're working for ICU, emergency department, or other positions within the facility, especially during times of high surges, during high stress. Healthcare is a very stressful part of working. Stress involved in these jobs can deal with health ailments. You have mental health ailments, issues and stress and post-traumatic stress and post-traumatic stress disorder. And of course, you can also have addiction because of the issues dealing with healthcare. And of course, there are challenges uh, that are widespread and with dissatisfaction of the job, burnout, high rates of depression, increased suicide, affect the professional careers in healthcare. So one group of Canadian researchers estimated that a prevalence of PTSD among healthcare providers is as high as 40%. That's that's amazing. In healthcare itself, 40% of the people have PTSD. In another study in University of Colorado, um, found that 18% of nurses met the diagnostic criteria of PTSD. In the Journal of Heart and Lung Transplantation, reported up to 48% of ICU nurses met the clinical criteria for PTSD. And in comparison, the incidence of PTSD in the general public is only 8 to 10%. So you can see that healthcare facility itself or being working in healthcare can really stress you out. And of course, the normal, stress in the general public is only 8 to 10%. And look at these numbers that we're looking at already, from 40, 48% to 18%, depending on what part of the facility you're working in. Normal operations, people are having difficulties. In the day-to-day operations, whether it be family life, whether it be scheduling, whether it be stress with inside work. But during a declared emergency or disaster, people's stress level go up even higher. You know what I mean? They're on edge. They're working at high capacity. They're dealing with sick and injured people. They're dealing with the fact of disasters that, such as tornadoes and things that may hit the facility themselves. They're worried about their loved ones. So stress levels go up even higher during emergencies. And of course, during a pandemics or other levels of national emergencies, the stress level of everybody goes up even higher in this facility, beyond the normal. It's vital that we take care of the health of our people, day to day operations, or but it's more important during a disaster or an emergency. We want to make sure that people are healthy and able to deal with what they need to deal with. We got to all staff. I don't care whether it's the janitor to the CEO has to have considerations for their health and their mental health during events. So there's several things that we have to deal with, consider with during an emergency, uh, especially during extended natural events such as natural disasters or storms. We have to make sure that our facility is operational and that our staff are healthy and well taken care of. Again, we're vital. We got to make sure if we don't have our people operational and healthy, we can't take care of patients. We got to make sure that they're fed and nourished, they get meals, they get drinks, they get regular rest periods, that sustenance is available to them throughout the day, not just junk food. They got to have some type of healthy food available to them throughout the day. And of course, we also have to consider our health issues and dietary restrictions that are happening. We can't just throw out a bunch of junk food or pizza or whatnot and expect that people that have dietary issues or issues like that are vegan or whatnot are being taken care of. We have to consider everybody. In preparation for extended events, somebody that may be here for a couple of days that are going to be stuck in here for rotation, we want to make sure that they have their medication on hand. Um, they got to be encouraged if they don't have their medication to let their supervisors know so that arrangements can be made to take care of the staff. Um, you know, uh, Healthcare workers have their own issues and their own health problems, and we want to make sure that we can take care of those health problems and that they get their medications and their food and their rest as they need it. Operational periods may be extended up to and beyond 12 hours. Usually 12 hours is the longest time that they're going to operate. But however, under extreme circumstances, that does happen and go beyond it. Um, if you're dealing with extended operations, you got to make sure you have rest periods for people to get away from the event and areas that are quiet that they can rest and recuperate. And of course, we got to make arrangements for people to leave the facility uh, that can travel. Hygiene. We got to make sure that the facility is clean. We got to make sure people are clean. They're washing their hands, that they're showered. Um, make sure food is clean and kept at temperature, not sitting out all day long so that it can build up, you know, uh, nasty diseases and whatnot. Surfaces have to be cleaned and disinfected regularly. Trash has got to be changed regularly. Trash is a great sustainer of disease. And of course, we want to make sure water temperature and quality is maintained. Of course, we want to make sure the temperature of the facility is taken care of. And, it's warm enough, then it's cool enough as needed. Staffing, health has got to be taken care of at all costs. We got to make sure that people are operational and in their areas, that they're not burned out, that they're not stressed out, that they've got enough rest, that they've got enough food, and they've got their medication. So we got to make sure that our health of our facility staff is kept up to date. Mental health is so important. As we saw that the stress levels uh, a couple of minutes ago are so high in healthcare. During disasters, they're even higher. We want to make sure that we maintain, the mental health of our people. We want to have debriefings after events. We want to offer mental health to people that need it, pastoral care as those that may need it, social workers and whatnot that are available in the hospital to take care of the mental health of our patient, of our not only our patients but also our staff. Again, critical incident debriefing sessions should be held after an intense event. This is to talk about the event, talk about, you know, feelings that happened or are going to happen because of the event. And we want to promote care of individuals and with unit supervisors and organizations uh, to set the boundaries that are supportive of our and the workers' well-being and resiliency. Yeah, we want to promote connection. Individuals should be encouraged to connect with others. Sometimes talking with a fellow worker is the best thing to do. Of course, we tend to turn to dark humor to deal with some events. That's okay. Um, Unit supervisors should provide time and space for personnel to express their fears, concerns, and needs without threat of stigma. That's a big issue because so many times that leaders don't take care of their staff, and there's a stigma for anybody that seeks help, and that shouldn't be the way it happens. If you're having an issue, you should be able to seek help and not worry about retaliation. Communication, again, we've got to communicate, you know, that there's issues, that there could be issues. We got to communicate what's going on. We got to communicate to tell people that they need to clean up themselves, that they need to rest, that they need to eat. They must update it on plans and issues, given directions, because nothing causes more issues than plans that are set in motion and then the workers are not told what to do or how to do it. And they must be given a path to communicate their wants and needs during an event. Sometimes somebody just needs a break, or they need some food, and they need to be able to communicate that in a manner that allows them to do that. They should be assisted in any way to help staff communicate with family and loved ones. Many times, stress goes up because people can't talk to their loved ones, uh, and they're worried about them out in the community. And of course, the inability to communicate with loved ones and family during an after event produces great stress on a staff. And of course, studies have found that increased issues happen with staff after disaster events. Leaders and administrators must do everything they can to ensure the health of their staff during and after an event. They need to take every step that they can to make sure people are healthy and prepared and able to work uh, at their job. Staff should seek guidance and expertise when designing responses and planning for health issues in the creation of emergency operation plans. Again, this should be part of your emergency operation plan. You should have some way of dealing with your staff and set in writing. Again, seek guidance and expertise when helping staff after an event. And that's it, guys. Thank you very much. You have a great day.